We're back and we're talking about whether bigger breasts means a better life and why so many women feel they need to have these larger breasts. And what I want to bring out at this point is how, because on one hand, fine, you help enhance people's self-esteem, Chrissy gets more money and tips, but let's remind people this is a surgery with potential complications. You said you had a case where things didn't go so well.
I have a patient that I recently saw. She came from another plastic surgeon and had a complication, which we do see, and it's not the surgeon's fault. She had encapsulation of the breast implant where the breasts get hard. She has now had 4 surgeries with this other surgeon and is $26,000 in debt and has moved back in with her father.
So, Chrissy, do you think about that, the potential complications, as you sort of head on into this procedure?
There's always going to be complications with any kind of surgery. There's
always risk.
Right.
You know,
there's always risk, but I'm wondering whether Chrissy thinks about those risks. She's so anxious to have her breast enhanced. I'm just wondering.
I don't think about it too much, no.
And Lacey, I know you've thought about it a great deal because your risks are like out of control. I mean, you know you're taking life-threatening risks every time you do this.
I've had a lot of complications, and it wasn't when I was just this big. I was as small as she was at one time. My concern is, does she know, is she going over the muscle, under the muscle? Does she have someone down here with her in Miami when she comes? I mean, what kind of support system does she have? I mean, I would reach out to her and meet her while she's here if she would like to talk to me about pros and cons.
But Lacey, I got to stop and hang a little lantern on something. You were the same size as Chrissy at one time?
Yes, I absolutely was, and I went into for the same reasons as she did. I was supporting my children. I was a AA breast size, and I needed to make more money.
Are you worried that Chrissy's going to go down your path? Just saying.
I absolutely. Well, I mean, it could happen, but I don't see that happening. I think that right now she's more concerned about her self-esteem and making a little bit of money. I don't think she's trying to be one of the biggest breasted girls in the world like me. It's a whole different story.
Let's take a call. Patricia in California. Patricia.
Hi, Dr. Drew. Thanks for taking my call.
Pleasure.
I want you to know I support Chrissy 100%. I was flat tested until I was about 30 years old. I had my 2 children, decided no more, and so I went in and had the silicone implants, which several years later, it scared me. I thought maybe they might break and leak, so I went back and had the saline done.
Okay.
And not to be a Lucy, I don't know where she's going with that, but anyway, your self-esteem is so important, and it does help. You don't have to wander around with things cut down to your belly button, but just a nice bust line is great.
Linda, thanks, Patricia. Linda, what approach is best in your opinion?
I would say in this day and age, most women want a very natural look, so most of us plastic surgeons are putting the implants underneath the muscle. Saline feels more like a water bag.
What approach?
Here in California, we tend to use an areolar approach.
So they're going just under the nipple, they're going under the muscle, and they're using silicone.
Yep.
Is that what you're doing?
Exactly. And believe it or not, through an incision about 2 inches wide, we get this implant through and under the muscle. And again, Dr. Joe, I want to reiterate, I mean, the size that Lacey is about 3,500 cc's. This is 1/10 of the size of Lacey. So she's, Chrissy's going for normal looking breasts to fill out a bra, fill out a dress, and feel good about herself.
Robin in Florida. Robin.
People go down the path of Lacey.
Hi.
Go ahead.
Dr. Drew, how are you?
Good.
I have been large-breasted most of my life, and it's not something I would have chosen. It's more of an inconvenience than anything. I find it interesting that so many women pay thousands of dollars for implants when I would give my left arm for a reduction.
Yeah, it's interesting to me that all women are unhappy with some part of their body.
Absolutely.
They really are. But Robin is in fact, my understanding is, Linda, that the most happy population of plastic surgery patients are the breast reduction patients.
Absolutely. The breast reduction patients are incredibly happy because they no longer have the back pain, the neck pain, the sweaty under breast issue. They can wear a normal bra. They don't have to go out and buy a $100 custom bra. They can go to Victoria's Secrets and feel sexy.
So, Robin, let's ask Chrissy, what's going on, Chrissy? Why don't you feel more like Robin?
Why? I kind of do feel the same as her, except I'm opposite. I've got none. I can't go into Victoria's Secrets and feel pretty because they don't make bras to fit me.
Most people just want to be normal. If they're flat-chested, they want to have a normal cup size. And if their breasts are too big and they're interfering with their daily life, they want them smaller. I mean, it makes sense.
All right, let's go to the call. I believe this is Zach coming up here. Is that right, Zach?
Yeah, hi, Dr. Drew.
Zach, go ahead.
I just wanted to touch on a little different on the self-esteem part of the conversation.
Excellent. Go ahead.
I mean, I have absolutely no problem with Christy wanting to feel normal and fit in and fit into clothes well. I'm worried when self-esteem is connected directly with one part of your body or one part of your life instead of being divvied up into multiple aspects.
Zach,
because when one part...
Yeah, that's a great point. Or really, I mean, although we can fix the outside and enhance self-esteem, is that really going after what's going on in the inside that often is the issue in self-esteem? So let's talk about that, Chrissy. Are you doing anything to enhance your mental health?
I don't believe I have mental issues. I'm a very outgoing person.
Well, you said you have self-esteem issues.
I do have self-esteem. I don't like being stared at because I always feel like it's because I am very small-chested.
But people have self-esteem issues about the way they look. I mean, I had a big nose and I had a rhinoplasty. I had plastic surgery. Now I have a normal nose and I feel great about it. And I move on with the rest of my life. It's not like you get fixated. Not everybody gets fixated on one body part and continues. When that happens, that's called body dysmorphic disorder. And you know, some of the people, some of the callers, maybe even Lacey, may have that where they're fixated on just one body part.
Lacey, are you worried about that? About having body dysmorphia?
No, I don't have that. I mean, one of these days I'm going to take my breasts out. This is to make money, and that's why I support what Chrissy's doing.
All right.
This is to make money. I've had a lot of other surgery, so.
I think breast surgery
I totally support her.
Okay, Lacey.
I think that breast surgery can really enhance somebody's self-esteem, but it is not the be-all and all. It's not a magic pill that's going to make you happy.
All right. Thank you, guys. Interesting. Thank you, Lacey. Thank you, Chrissy. Good luck, Dr. Salzar, with your patient and whatever re-repairs need to be done. And Linda, I appreciate you coming in and talking about this. It's just something. I think the important thing here, above all else, is there's two big things came out of this conversation. One, if you have self-esteem issues, okay, fix the outside, but let's really focus on the inside as well. And most of those solutions come interpersonally, in your relationships. That's where people develop self-esteem, in quality, attached, secure relationships. Number one. And then number two, to really understand that these surgeries are not simple. They may be a series of surgeries that follow.
This is a lifetime commitment to a set of implants.
Okay, there you go. Next up, a star of The Secret Life, the American teenager